If you're thinking about getting pregnant in the next year, here are 10 things that you can do to optimize your natural fertility. First is to stop smoking. We know that smoking can negatively affect your ovarian reserve as well as your sperm quality. The next is to reduce your overall alcohol intake, ideally less than a couple drinks a week. We also suggest limiting your caffeine to a moderate amount per day, around 200 milligrams, which is also the amount that we recommend during pregnancy. We suggest taking a prenatal vitamin with folic acid specifically at least 1 month before you start trying to get pregnant. You can also consider that both people in the couple take a CoQ10 supplement. Dr. Natalie Crawford covers this more in this video here. You can work on obtaining a BMI between 19 to 29. Increasing obesity is associated with a decreasing pregnancy rate as well as an increased time to conception. This also applies to the people with a BMI under 19, as they have a 25% increase in duration to time to conception. You can consider working with a registered dietitian to find ways to optimize your intake of protein, fiber, and vitamin-rich vegetables. Consider small ways that you can limit your exposure to plastics. I think it's really easy to go off the deep end with this, but small sustainable ways that you can do this is no longer using plastic cutting boards and no longer heating your food up in plastic containers. If you have very painful or irregular periods, I highly suggest booking a problem visit with your OBGYN so we can look for a diagnosis. If you want to get a little bit more technical about it during the trying to conceive period, you can also really start tracking your ovulation. Several different ways that you can do this, from just monitoring your body symptoms to using ovulation predictor kits to using fertility monitors like a Nido or the Oura Ring. Ideally, we want to have that sperm at the egg as it's ovulating. So having intercourse every 2 days during that fertile window is the optimal timing. Remember that it is very normal for it to take up to 12 months to get pregnant. But if you have any concerns, I highly suggest making an appointment with your OBGYN to discuss further.